So I had an interesting conversation with a patient and her mom yesterday. Patient came in for an eval, uh, low back pain, mostly neck pain, college student. Most of her symptoms flare up when she's studying. So as we're going through her history review, she said that she had gone to previous physical therapy for this issue, but it didn't really change anything. So I circled back while we were talking during her subjective reporting and asked her what they did at physical therapy. And she said, oh, well, they gave me some stretches and some exercises. And then she said this was on telehealth because our insurance will pay for so many telehealth physical therapy visits throughout the year. So I said, oh, okay. So did they do some kind of evaluation or something like on Zoom and like watched you move to try to figure out what's going on? And she said, well, no, this was a phone call. So she basically told them where her pain was. And then they gave her some stretches and some exercises to do. Needless to say, that didn't work. And the exercises that we gave her were completely different. And of course, we don't ever give anybody stretching, so we didn't do that. So this is a wake-up call. It should be a wake-up call to you students, to you new grads, and to you guys that are experienced PTs, that this is the way things are going to continue to go. So insurance companies are going to continue to cut reimbursement. They're going to continue to give patients virtual PT options to take you out of the picture. And the reason why they're doing this is because A, they're an insurance company and their job is to make money, not give PTs money. And B, more importantly, and what you can control is they're doing this because the PTs of the previous years have continued to give away our profession. So every time you have somebody come in and you give them corrective exercises and you give them stretches and you give them a rub down and you put them on ice and you put them on a stationary bike, which takes absolutely no thinking, and all you're doing is attacking their symptoms or trying to decrease their symptoms with strategies that they can do on their own, you are killing your ability to progress as a professional, and you're killing our profession, which is what the last 30 years of PTs have done. They've done absolutely nothing to become experts. They've done absolutely nothing to, number one, evaluate every patient from head to toe, something that their friends can't do, some person on a telephone can't do. Number two, use some kind of critical thinking and application of science to attack the root cause. So rather than chasing symptoms and just giving people garbage that they can get online, or they can get on a telephone call with somebody who's supposed to be a PT, or they can get from their neighbor, you got to do something that requires you to have a college education, requires you to have a degree, requires you to have a license, which most PTs don't do. So here's your wake-up call. Stop doing garbage PT. Stop attacking symptoms. Stop listening to people talk about their symptoms, and start thinking and start evaluating function. Once you do that, use what you learned in school on the physiological level, on the biomechanical level, on the anatomical level, to get to the root cause, reverse the root cause, and reestablish normal function. This is what patients can't get on a video call. They can't get on a phone call. They can't get online. So stop doing the things that are killing your career. And if you want to know how to do all of that stuff in one seamless system, you need to get in the membership, because that's what we teach all of our students. Apply critical thinking, get to the root cause seamlessly, easily, and give your patients immediate results on visit number one. So what kind of results do you think she got on visit number one when she came here? Total resolution of symptoms, because we reversed the root cause, the root cause of her problem, which means we established normal neuromuscular physiology, which nobody else can do because they don't understand A, how to get there, and B, how to get it reversed. So that's what you're gonna learn in the shift. You're gonna learn critical thinking. You're gonna learn a seamless process that takes you from evaluation to treatment, to patient education, to therapeutic exercise progression. So when you're ready to stop riding along on the train that's taking your career down a dark hole to frustration and burnout, make sure you join the shift.